Well, this is a really important issue for the state of Rhode Island and for all Rhode Islanders. Most Rhode Islanders will receive care from one of the institutions that are affected by this merger. We're going to incorporate 8 hospitals under one roof. And so for Rhode Islanders, this raises questions about quality, about access to care, and about the price of care. The merger promises that we will have higher quality care. That's one of the principal goals here. It's unclear at this point exactly how that's supposed to occur. That's going to be something that we will discuss in the coming weeks and months as we evaluate this. Around the country, we've seen a lot of hospital mergers over the past decade. And one of the things that's happened in the wake of those mergers is we have tended to see prices rise. That's a concern for Rhode Island, because if this happens, then perhaps health insurance costs may rise over time. One of the things that I've been looking at with students over the past year is how this merger is likely to play out. And in our conversations, we quickly realized that there's a need for public education here. This is a complex process, both in terms of evaluating the merger and in terms of understanding what's likely to happen as a result of it. So one of the things we really hope for with this podcast is that we'll connect average citizens to the issues, to really help unpack what this means for their pocketbooks, for their access to providers, and for the future direction of our healthcare system. Looking for a launch in April. Actually, hopefully in early April, we will be ready to unveil our initial broadcast. And one of the things that we're hoping to do in that initial podcast segment is to give folks a sense of how this merger came to be. This has been a long time coming. It's been about a decade or more of evolution here. So Care New England and Lifespan have been kind of an on-again, off-again romance for some time. And so we're now at the point where it seems that this may actually come to fruit. We're hoping to bring in folks who are stakeholders. Our team of students and myself will provide some context, but we hope to bring in folks from the provider community, certainly members of the respective organizations that are talking about merging, but also folks who are not. One of the significant elements here is that while 8 hospitals in Rhode Island are coming together, there are 5 other institutions that are not included in this. And one of the things we want to help unpack is what that means for them. So if you're at South County Hospital or Westerly Hospital, or perhaps one of the charter care facilities or Landmark Medical Center, we want to understand how this merger will affect them going forward as well. Well, I think our goal in this project is to create a resource for folks, something that they can listen to and understand, place the news into context. We don't see this podcast as being essentially a news activity. It's more of an analysis that will help folks make sense of the developments that they're reading about and hearing about. So if they're able to listen to our podcast and essentially form their own informed decisions about this merger and what it means for them and their families, we'll see that as a success. First of all, the hospital's finances have been precarious in the wake of COVID. Both Care New England and Lifespan have faced some struggles, more so with Care New England, but also Lifespan, and that's not unusual. To be clear, hospitals around the country are having the same challenge, and so there is a desire here to try to create some new efficiencies. One of the concerns, of course, is that when we start talking about efficiencies, many folks immediately start thinking about job losses. And certainly the unions who represent various health professionals at these hospitals are very much attuned to that. They are very concerned that in an effort to kind of streamline these organizations, we may see job losses. The other issue is that for Rhode Island, Brown University sees this as an opportunity to attract more medical talent, more research funding, et cetera. If we have a consolidated organization that's stronger, we believe we could compete more effectively with Boston area hospitals. One of the big things, I think, for me, I expect the Federal Trade Commission to play a significant role here. This consolidates a lot of hospitals under one roof. We're talking about 80% of the beds in Rhode Island hospitals would be affected by this merger and consolidated under this one new umbrella. That's going to raise red flags for the FTC. And so I know the parties involved really believe that this is going to be a smooth sailing process in terms of getting the merger approved. I think the federal government is going to take a long, hard look at this. And I think the state health department and the AG's office will as well. I have another team of research assistants working with me to explore hospital community benefits. And one of the things that we're looking at is how does Rhode Island's law and regulations on this subject compare to other states? One of the reasons for this is that we're trying to get a sense of, as we consider the merger, are there new requirements or if you will, guardrails we should put into place to make sure that the resulting merger would protect patients and particularly protect access to care for the uninsured, for folks who are essentially receiving what we call uncompensated care, that is free or reduced care from hospitals. And also, here's an opportunity. As state regulators consider this merger, we would encourage them to look at the full range of those hospital community benefits and to think about ways that we can leverage the review of the merger to really ensure that Rhode Islanders have a much improved healthcare system if this does go forward.